The other thing, actually, that the Alzheimer's guidelines, Association Guidelines for Best Practices is going to address is it's a multidisciplinary group and has the primary care setting, specialty, and subspecialty. But something that's common to all of us is how do we discuss and disclose the diagnosis?
Yes.
So how do you set that up, and what do you do? What's your process?
I think this is probably the most important appointment that you have with the patient and hopefully care partner, which I think is essential when you're disclosing the diagnosis. Hardest thing in primary care practice is you have to allow time. So these are typically visits that are at one end or the other of my day before lunch at the end of the day, just so that I can really spend the time that this family and patient need. So I think disclosing the diagnosis, as we've discussed, saying what do I think you have? Is it normal aging? Is it mild cognitive impairment? What does mild cognitive impairment mean? What is dementia? You've gone through this process, but I think the iterative training for the patient and the caregiver to say what is dementia? What does that mean? The prognosis based on my stage of dementia. What can I expect? What do you see in me that makes you say I have dementia? That's a lot. Like, what are you seeing? My memory's okay, but I started looking at porn on the video. You know, what is it that you're seeing? There's a lot of misconceptions, and so I think this is a time of active dialogue between the patient and the caregiver, and truly understanding the diagnosis and the etiology. I think often we, in primary care, we may not get through the 3 steps. We may pause and not really say, I think you have Alzheimer's, and then the hope, the next steps. You have this, but as I said in the beginning, I'm part of your team, and here's what I think the next steps could include, and how do we partner together to walk this path, and that includes involvement of other subspecialties for supports, community resources, the Alzheimer's Association, incredible resources for both the patient and the caregiver. And I know we'll speak a little bit more specifically about the caregiver, but what I typically say at this point in the evaluation is the very most important treatment I have is your wife, your daughter, your care partner who's going to hold your hand and be with you throughout this process.
So that's really important. So maybe we can talk about it now, about the caregiver and care partner. Sort of assessing how they're doing. That's part of the process. How do you approach that from the beginning, and how do you assess it, and then how do you disclose that?
Yes. I mean, part of our evaluation is actually doing caregiver screening as part of the evaluation. So we do use formalized caregiver burden screens. So as I approach the diagnostic workup, I said there's usually homework for both the patient and the caregiver. So many of those screens they can complete and bring back with them to an appointment. Again, it helps me very quickly zero in on the critical needs, respite, time for themselves. I really spend a lot of time talking about the data that suggests that caregivers often die before the patient with dementia, and that's very surprising usually to patients and family caregivers. Oftentimes there's a reluctance to bring in just a little bit of care that can make a world of difference. We really started doing formalized care planning when the Medicare came out with special codes that allowed us to have that time and bill for that time. And 2 years into that process, the biggest impact we've had on the treatment of my patients is caring for the caregiver. And it's very heartwarming. I had two couples that came in last week, and we had spent a lot of time with education and caregiver support groups that we have on our campus, and day programs for the patient with Alzheimer's. And the same interaction in the clinic office, which would have been a frustration where the patient might have said something inappropriate or flirted or did something that initially would have embarrassed the caregiver, now we're all able to redirect and laugh and smile. And it was just to be able to bring joy back in life by this teamwork and team approach. Really, there is always healing.
Yep. So the kind of a multifactorial approach is the sort of the appropriate timely diagnosis. Sounds like always monitoring, educating the patient and the care partner, developing the shared goals. And then you mentioned pharmacological. Sounds like, you know, taking away the bad meds and things like that. Well, this next segment we'll talk a little bit about pharmacology, but it sounds like it's always driven through the patient and the care partner, so they have to understand that.